Buenas tardes a todos. Bienvenidos en
Welcome to one and all. Welcome to this new webinar. The title is very interesting, How to Recover Vitality and Desire in Women Naturally. My name is Karin Absalem. I'm the Scientific Director of ProCare Health, and it's an honor to have here with us this evening these two speakers. We have with us Dr. Francisca Molero, who is very well known and needs no further introduction, and Dr. Fernando Losa, who will be moderating the webinar. Let me explain what this GynaCare platform is about. It's a platform available to all healthcare professionals. The goal of this platform is to provide continuous medical training for physicians who work in the area of gynecology, but also for nurses, midwives, pharmacists, and all healthcare professionals who are interested in the presentations that we'll be proposing. Apart from organizing these webinars free of charge every 15 days, we'll also have available on this platform online courses, scientific papers, news, videos of presentations and conferences, and interviews. And most of the content will be soon translated or subtitled into English. This means that you will have the content also available in English. Without further ado, I would like to welcome again our two speakers of this evening. Dr. Francisco Molero is a clinical sexologist and gynecologist, and she's the director of the Ibero-American Institute of Sexology and president of the Spanish Federation of Sexology Societies. Dr. Fernando Losa is also a gynecologist. He works at the Sagrada Familia Clinic in Barcelona. He's the coordinator of natural products at the AEEM, and he's an expert in aesthetic gynecology by the University of Barcelona. I will now give them the floor. And I would like to remind you before that the content of the webinar will be recorded and will be available on this website, GynaCare FMC. Thank you very much and enjoy the webinar. Good evening to one and all. I know that many of you are overwhelmed with so many webinars, but I have to say that today's webinar is special. I think it's going to be interesting for all of us for our daily practice. You know how COVID has had an impact on our lives in all areas of our lives. For example, we have daily webinars, and it's had an impact also on sexuality. Maybe Paquita Molero will be able to tell us about the studies that have been conducted among healthcare professionals regarding sexuality, the impact of the COVID on sexuality. I have participated in this survey, and I don't want to take up any more of your time. This presentation is going to be very interesting, and I'd just like to tell you that before the presentation we're going to have some questions. This is a training website, and the goal of this website is for us all to learn. So we will need you to answer these questions. These are self-correction questions. And also, after the presentation, we will also have another set of questions for our satisfaction survey. If you don't answer them now, you can send them by email. And without further ado, I would like to give the floor to Dr. Molero. She's very well known. She's a sexologist and gynecologist, and she's been working in this field for many years, and she's a great expert, and we'll be learning a lot from her. Francisca, Paquita, the floor is yours. Hello, how are you? Good evening. I would like to thank you all for being here today in this webinar. In another webinar, we've all been joining many webinars during the lockdown and after the lockdown. And we're going to be talking about a topic that I find very interesting and I enjoy it very much. I enjoy learning new things about it. Before we start, we have some questions for the audience, as Dr. Losa just explained. I am going to put the questions on the screen. Let me read them out. The first question is, how do you think the COVID-19 lockdown has impacted women's sexual life and the couple's sexual life? You have to choose one of the following options. Stress has caused exhaustion and reduction of libido. Now there is a greater interest in strengthening couple relationships. It has favored and strengthened the sexual health of couples. And the last option, statements A and B are correct. Well, it seems that most of you think that statements A and B are correct. All right. Second question. Is it possible to improve women's desire by increasing endogenous testosterone through a non-hormonal phytotherapy treatment? Select one of the options. I don't think so. I would need some clinical evidence. Yes, I have tried phytotherapy and I know its benefits. I think that phytotherapy only works as placebo. I don't know, but I would be interested in testing it with my patients. All right. I see many of you have tried phytotherapy and you know the benefits. But there's a 30% of you who don't know about it but are interested in trying it. And you will see how interesting phytotherapy can be. Next one, please. What's the prevalence of feminine sexual dysfunctions in pre-menopause? Less than 20%, between 20 and 40%, between 40 and 60%, almost 90%. That means that almost 90% of our patients have sexual dysfunctions. Well, there are many of you, well, some of you, that think that almost 90% of the patients have sexual dysfunctions. Well, you do need to listen to this presentation then. All right. Today we're going to talk about improving vitality and desire. How do you think these benefits can be obtained in our patients? Option number one, you notice the vitality and desire improvement at the same time. You notice desire improving in the first week and afterwards the vitality. You notice vitality improving in the first week and then desire, or none of the above. Well, we have diverse responses. We hope that today's presentation will help you understand many areas, particularly when we have an 11% of you thinking that 90% of our patients have sexual dysfunctions. All right. Paquita, the floor is yours. Thank you. All right. I'm going to start with this slide. I'm going to explain about sexual dysfunctions. Some of you think that 90% of your patients have a sexual dysfunction. And first of all, I think we should differentiate between a sexual problem and a sexual dysfunction. A sexual dysfunction has a lower prevalence. The prevalence of sexual dysfunction, according to the DSM-5 criteria, which are the criteria that we use for diagnosis, the percentage would be about 12%, although in the literature the percentage is 20 to 40%, but this is based on all clinical studies that didn't have homogeneous criteria. The thing is that many patients that come to see us with a sexual problem, with a desire problem, or because they have discomfort or have problems with arousal, usually it's a sexual problem and not a sexual dysfunction. However, even if it's a sexual problem, we need to give them guidance. And we have to see how important this is for their quality of life. In any case, sexual dysfunctions do last through time and cause anxiety in patients, and they impact negatively their interaction with other people, with their partner, and with other people. And when we're talking about sexual dysfunctions, we know that the sexual response in women is circular, and there can be a problem with desire, and this can be secondary to another problem, to another sexual problem or dysfunction. Sometimes it's difficult to determine whether it's a primary or secondary sexual dysfunction. In any case, there are three main groups of sexual dysfunctions. Firstly, there's a disorder of interest and arousal, then there's an orgasm disorder, and then there's a pain disorder, where we would have included vaginismus and dyspareunia. Any of these dysfunctions can have an impact on sexual life. And very often when a patient asks about a problem and it's a chronic problem and it's therefore a dysfunction, then we see that there are different dysfunctions involved, and it's difficult to determine which one is the primary one and which one is the secondary one. In any case, sexual dysfunctions do affect emotional relationships. It's quite a common problem, and it's usually associated with age, because depending on your age, you are in a different life stage, and in our different life stages, we have different events that impact our sexual satisfaction. Usually, the most common problems have to do with a reduced vaginal lubrication or dyspareunia. We know how important dyspareunia is. We're talking about pain. And pain is a key element to limit sexual activity. And there is a lower sexual desire. Patients don't feel like having sex, they feel lazy, they don't feel they have the energy for it. And very often, we also see orgasm difficulties, and they're often associated with a sexual activity where there's no desire, or whether sometimes there are patients who've never had an orgasm before, they don't know their bodies well, and there's also some medication or conditions that can have an impact on orgasm. In any case, women's sexual dysfunctions are less known than men's, and they have a significant impact on the quality of life of women and their emotional relationships. And women who are not satisfied with their sexual life have a lower psychological well-being. And this is an item that has now started to be studied in the health surveys. This item is now included in health surveys because now the population is more and more aware of the fact that a healthy and satisfactory sexual activity is an element that improves the quality of life of patients. And there's also a small percentage, however, of women who ask for help. Women's sexual dysfunctions are multifactorial. When we are talking about sexual problems and sexual dysfunctions in women, we have to think about the psychosocial aspects because there are biological aspects and physiological aspects, but there are also many cultural aspects, our culture, our education, what we have learned. And there are also some beliefs regarding relationships and interpersonal interactions, and these are things we have to deal with in different stages of our lives. And therefore, when we look at a patient, we have to see whether they have a special situation of depression, for example, because this is not going to help with a satisfactory sexual activity. Sometimes there is too much distraction, sometimes we want to control our sexual response, and we have this cognitive part that is blocking the response. And then there are patients who use certain medication that can have an impact on their sexual activity. Then we have the social cultural influences. There's this conflict between what I want and what I should want, because there are these erroneous beliefs that can be an enemy for sexual satisfaction. These beliefs and these taboos are difficult to acknowledge very often because we believe they're true. And then we have interpersonal relationships, how our sexual partner behaves with regard to their emotional behavior. And when we talk about partners, we're talking about having them and not having them, having lost a partner, not being interested in having a partner. So we're talking about the element of partners in general, and it's a key element for the sexual satisfaction of women. And then we have the aspect of technique, because we haven't been taught erotic or sexual skills. We have just learned by practice. This means that at certain moments, when there's a change in our lives, when we start a new stage in our lives, sometimes the fact of facing a new situation means that we don't have the capacity to respond properly, and this leads to problems. And in some couples, we see a lack of privacy. This usually happens with mature women, mature couples who have teenage children or children who haven't left home yet, and their children bring their partners home, but they never take into account the privacy of their parents, who need to always pay attention to see whether their children are at home or not. And this happens as well when you have a couple taking care of an elder member of the family, when the grandparents are at home. And then we have the physiological factors. These are the most well-known factors. There are different systems, the vascular system, the neurological system, that have an impact on our sexual activity. Chronic diseases, acute processes will have an impact on sexuality. And medication, you already know that diabetes and hypertension are two diseases, prevalent diseases, that have a direct impact on sexual response in men and women, particularly in the arousal phase. But apart from all these health problems, there's another item that we should bear in mind, and it's very often the most common one, and it's fatigue, physical tiredness, because very often we have no sexual activity, not because we don't feel like it. It's because sometimes we feel like it when we don't have the time. But when the time comes, we are tired. We are tired because we lead very busy lives. And we thought that with the lockdown, our lives wouldn't be so stressful, but they're still very stressful because those who had stress at work are still stressed at home because they're working from home. But anyway, that's another topic. But fatigue, physical tiredness, is a very important aspect to limit sexual activity. We've also spoken about the importance of the different stages in life. On this slide, here we have some of these key life stages, for example, menopause, but there are also other important life stages where we see more fatigue and hormone dysfunction, for example, during the pregnancy, particularly during the first term of a pregnancy, where there is more fatigue, there's the uncertainty about knowing whether that pregnancy will go well, and also during the postpartum period, during breastfeeding, or when taking hormone contraceptives that can have an impact on reducing lubrication and reducing sexual desire. The prevalence of women's sexual dysfunction does vary, and I would talk about the prevalence of sexual problems that affect us and that can appear at any time during our lives, but they do increase during the postmenopause due to the vaginal discomfort and dyspareunia, because apart from having the typical effects of the menopause, where many things in life change, where your role in the couple changes, that your role in the family changes, and there's also a reduction of the sexual desire, and it's a time when women get to know themselves better and they think more about their body. It's a key period in life, and women in the menopause are very interested in their own sexuality with regard to their partner and with regard to themselves, with regard to knowing themselves better. Remember how before the COVID-19 we had this Satisfyer, and there was this great interest about the Satisfyer, about how it worked, and there were young women and adult women interested in the Satisfyer. What's also very, very important is the relationship that we establish with our patients. We know that the topic of sexuality is becoming more and more open, but our patients still feel embarrassed to talk about it, and there's a lack of communication. We know that sex is important, and we know that our patients continue to have a sexual activity. In fact, there was a survey where doctors realized that their patients were having a greater sexual activity than they expected. That was a surprise. And patients feel embarrassed to ask some questions regarding sexuality. And, well, sometimes they think that the doctor won't have an answer to their questions. And maybe that's because the doctor hasn't discussed this topic before with the patient. So it's important to ask questions to our patients. Ask our patients, now that you are in your menopause, how do you feel? How is your sexual life? Do you have any problems, because sometimes they may feel that they have no energy. So we should tell our patients that they can ask us any questions that they may have. The idea is to make it easy for our patients to ask these questions, to be open to discuss all these topics with our patients. So if our patients have questions, they can ask them. In fact, when we ask questions about this topic to our patients, then there are 3 times more possibilities of them telling us about their problems. All right, first of all, what's the most important thing? The history. The patient's history, and we also have different scores. There's a long one, that's the FSFI, where we look at the female sexual function, and it's used in all the clinical studies. And with this score, we look at the different indicators of the sexual response: satisfaction, arousal, pain, orgasm, and so on and so forth. When we talk about women's sexual dysfunctions, we should refer to hormones. Hormones are absolutely key. We know how hormones can be impacted by the menopause, by pregnancy, by oral contraceptives. And hormones are key, not just for our sexual life, but also for our brain. And now we know more about the hormones, and we know, for example, that there are receptors in the pyramidal neurons, and we know how important it is to modulate different androgenic and estrogenic receptors. So we know more and more about the sexual response and how the sexual response is associated with the hormones. And hormones are very important for the brain, but also for the body and for our genitalia. We know how important estradiol is for vasodilation, lubrication, elasticity, and testosterone is very important for sexual desire and arousal. In the case of testosterone, I believe that there'll be more research in the future about testosterone, because until now it's been very clear how important it is in men, but in women there's still a lot to be known about the specific levels of testosterone that can help improve the sexual response. And according to the latest research, there is a clear relationship between the different hormone levels and the sexual response. Testosterone in women, additionally, has an impact, as I said before, on the brain, on the body, because it helps maintain a good condition of our bones and muscles, and it also has an impact on our sexual function. When we talk about desire, sexual desire, we're talking about impulse and motivation. Impulse is driven by hormones, particularly by testosterone, and is very prevalent in younger ages, whereas motivation has to do with the quality of the estrogen and is more prevalent in mature ages. And it's important to have a balance between the two, between impulse and motivation. Hormones change throughout our life, and they are directly associated with age. For example, in estradiol, testosterone, and DHEA, there is a change of the volume of these hormones in childbearing age and in the menopause. there is a reduction of these hormones in the menopause, and this leads to changes that are also associated with vitality. I mentioned before fatigue. There are so many times when patients say to us that they have no energy, they feel that they're lacking energy. And this is very much related with the reduction of the hormone levels, and this has a direct impact on sexual desire. And it also impacts, of course, our muscle mass and bone mass. During the menopause, there is a hormone reduction, as I said, and this will lead to changes. It will lead to changes in our mood. We have mentioned before the estrogen receptors, androgen receptors, and they have an impact on the sexual desire. And there are also other hormones such as serotonin, that help modulate our mood. And estrogens are very important, and some other substances as well. I remember, for example, when we started studying the premenstrual syndrome, we used to prescribe vitamin B complexes to improve the mood of our patients. There is therefore a clear relationship between the hormones and the receptors. And there are vitamins such as vitamin B that are very important in this regard. And in the menopause, we saw more anxiety and irritability. But there are some positive things as well, and it's all about how you deal with the different stages in life. Every stage in life is very interesting and important. Each one has its own characteristics, and sometimes there are difficulties, but all of them are very interesting. How do we approach all these sexual problems? How do we help our patients when they come to see us and they say they have no urge to have sex, they are lacking energy, but they feel sorry for their husband or their partner because they're very nice? Well, I have a methodology that's very simple. I call it PLICIT. It's a Spanish acronym. Those of you who know me know how often I use it. I have implemented it very extensively because it's a methodology that starts with asking questions and listening actively. It's important to ask our patients if they have any problems in their sexual life, or just telling them that we're there for them if they have any problems. Then the next stage is targeted information. If there's a patient who says that they don't feel like having sex, then we'd have to try and see what the core of the problem is. And we have to explain to them how desire works. It's a circular type of reaction, and desire can be aroused if it's approached properly. And this is very important to explain to our patients. And it's also important to know what's the patient's life situation, whether they have any illnesses or what is their situation in general. With all this information, we'll be able to help them in a better way. We'll be able to provide them with adapted solutions. And it's also important to give them some specific suggestions. Suggestions to improve their lifestyle. This means exercising, not smoking, controlling their weight, and it's important for our patients to be aware of the importance of sexual activity, because having an individual sexual activity or a shared sexual activity will make our body work much better. It's important for patients to be aware of this, and we should also offer these suggestions with two main goals. If they have a partner, we should tell them they should improve the quality time with their partners, their emotional quality time, by spending more time together away from home. Maybe they can just go out for a walk an hour a week. And then in their sexual life, we can tell them about massages. And for example, it's important to share with your partner the fact that you do desire them. You can text them saying that you wish to have sex with them. And in women's sexual dysfunctions, we have limited pharmaceutical options, but there are some. And then there's the option of sexual therapy, because sometimes there are problems that are psychological problems and relationship problems. What are the pharmaceutical options available? Well, today in Europe, we don't have any drugs with a specific indication for sexual desire and arousal disorder. However, in the US, there are two drugs that have been approved by the FDA, flibanserin and bremelanotide. Flibanserin is a pill. It was approved in 2015, and it has an effect on the central nervous system. It improves norepinephrine and dopamine agonists, and it modulates the serotonin receptors. So it improves sexual desire. However, the findings of the clinical studies haven't been very impacting. They've been quite discreet. However, it's important to take it into account, even though it's not available in Europe, because the broader the pharmaceutical options available, the more customized the treatment we can offer to our patients. And bremelanotide was approved last year. It's a subcutaneous injection on demand, and it's a synthetic hormone. It's a melanocortin agonist. It also acts on the central nervous system, and it increases the levels of endomorphins. And in Europe, what do we have available? Well, the only thing we do, particularly in patients who are taking antidepressants, and we know that SSRIs do reduce sexual desire and arousal. And in these patients, we may try to switch their antidepressant to bupropion, because it causes less problems and it can even have a positive effect on desire. If this is not possible, well, we can add a 5-PDE inhibitor, i.e. a vasodilator. This is what we know as Viagra and tadalafil. It has an indication in men, not in women, because there are no clinical studies in women, but I do hope that we will have them in the future. So these are the pharmaceutical options that we have available, but there are other alternatives. When we have a low sexual desire due to dyspareunia, due to vaginal dystrophia or dryness, there are estrogens and other treatments that can help with vaginal problems. And there are drugs that are currently being researched, such as sildenafil and apomorphine, and also oxytocin and vasopressin. So there's a new line of research that's really interesting for new drugs that can help with women's sexual desire disorders. Before I mention testosterone, and testosterone doesn't have an indication for desire disorders, but in the past we had a patch called Intrinsa for surgical menopause. Although it wasn't very successful, it wasn't as beneficial as expected, and it was discontinued. Maybe it was available too soon. Maybe it was available on the market when women's sexuality wasn't such a discussed topic. And when we talk about testosterone, the problem is that it's difficult to measure it because we know how important endogenous free testosterone is as an indicator in men and women's health, but we don't know what's the specific testosterone level that can be positive or negative in women's health. But I do think that in the future we will see more research in testosterone in women. But as we don't know what the specific testosterone levels that are required, it's important to modulate them properly. And in women's sexual desire and arousal disorder, we have an alternative that has some scientific evidence, and this is phytotherapy. Phytotherapy is very well tolerated by patients. However, healthcare professionals have had their doubts in the past because there was no scientific evidence, but now we see more research in phytotherapy, more clinical studies in phytotherapy, and phytotherapy is very positive for this type of problems. And this is Levicare. This is a food supplement with very interesting ingredients: trigonel, trebolus, ternera, aphrodisiaca, damiana, ginkgo biloba, and also vitamin B complex and selenium. And this is a very interesting product because we have clinical studies that support that this product improves the sexual function, it improves the FSFI score, it improves the associated hormone levels. There are studies on the free testosterone and on the SHBG as well. And good results have been seen after 2 months. And Levicare also includes vitamin B and selenium. I mentioned before how important fatigue is when there's a lack of sexual desire. This is a very important topic. And in the clinical studies, they looked at the effects of vitamin B and selenium that give more energy already during the first week. And when there's more vitality, then there's an improvement of desire, although the improvement of desire is really seen after 2 months. Selenium provides vitality and improves physical performance. It has antioxidant benefits, anti-inflammatory effects, and it also has a positive effect on the active thyroid hormone, and it improves physical performance, vitality, and general well-being. Vitamin B is very important for an appropriate synthesis of the DNA When there's vitamin B deficiency, there's an impact on memory, on cognitive function and dimension. And vitamin B is essential to improve the patient's mood. I mentioned before how we used vitamin B complexes to improve the mood in PMS. So there's broad experience with vitamin B. Now, with regard to the phytotherapy ingredients, we'll start with Trigonella. Trigonella is very interesting because it has saponins, and this promotes the endogenous free testosterone, and this is very important because the increase is an increase that's appropriate, and this is very reassuring for healthcare professionals because, as I mentioned, the testosterone dose is very important. The effect of endogenous free testosterone is positive on sexual function, on general well-being, and on the levels of vitality and energy. Additionally, Trigonella increases this endogenous free testosterone versus placebo. There were 80 women included in this study, and the difference is very significant. Trigonella also increases sexual activity in women. We all know that women are sexual beings, and women may have the same sexual desire and want to have as much fun in their sexual lives as men. And when women are feeling well, then they feel more like having sex. And in this study, there's this increase by 2 in the sexual activity in this group of 80 women. Trigonella also intensifies arousal in women and sexual satisfaction because desire and arousal sometimes don't go hand in hand, in the sense that if we don't have a spontaneous desire, just feeling that arousal, those sensations, when the physiological arousal response is activated, and this has to do with the vascular and neuronal and endocrine systems, those sensations will lead to arousal. It's very important to have all those sensations when there's a hormone deficit and where there are conditions such as diabetes and hypertension. They can be limiting desire. On this slide, you can see the findings of this study and how all the indicators of desire, orgasm, sexual behavior, and sexual arousal and sexual fantasy do increase with Libicaire, and they increase significantly after week 4. Tribulus is an interesting ingredient. It's been widely used in men, and the indication is for erectile dysfunction. And you know how erectile dysfunction is an arousal disorder. And Tribulus helps increase desire, and it also helps with the sensations with the vascular system, and it also increases vitality and reduces fatigue. These are the findings according to the FSFI score after 4 weeks of treatment. As you may see, there's a significant change versus placebo in all the indicators of the FSFI score. Another ingredient is Damiana that also promotes energy. In fact, it's called Tornera aphrodisiaca, and it improves arousal. It includes flavonoids that are aromatase inhibitors, so this maintains the endogenous levels of testosterone, and it also is anti-inflammatory, antibacterial, antifungal. The goal is to maintain the endogenous testosterone levels, and this is a key aspect on which this phytotherapy treatment works. Then ginkgo biloba is a phytosome. It's a wonderful antioxidant for the vascular system, and it improves the blood flow, particularly in the genitalia. As I said before, good sensations help improve or maintain desire because you're feeling those sensations. This is a very interesting pyramid. We see here how hormone changes can lead to lower vitality and lack of well-being, and to physical and emotional stress, and this can lead to a reduction of desire. And you see here how all the ingredients of Libiker, Trigonella, Tribulus, Damiana, and Ginkgo biloba will have a positive impact on the vitality of our patients, and in this way they will feel more prone to have sexual relationships. This is a pilot study that was conducted with women with ages between 45 and 65 years, women with a low sexual desire. It was a 2-month study. These women had a diagnosis of low sexual desire according to the DSM-5 criteria. The dose was 2 tablets a day. The goal was to assess the efficacy of Libicare in women with low sexual desire. The mean age of the patients was 53.9 years, and Libicare showed a significant increase in the FSFI score and in most of the individual areas. Only in pain reduction we don't see this significant difference, but we do see it in all the other indicators. Additionally to this subjective assessment with regard to their sexual response, the study also analyzes the testosterone and SHBG levels, and there's a significant increase in free testosterone and a reduction of SHBG at 2 months. And the increase of testosterone was correlated with the reduction of SHBG, and this means that it maintains the endogenous free testosterone. There are no adverse events with Libicare, and according to this study, 2 pills a day of Libicare can double the sexual activity in women. It can increase arousal, it increases the free testosterone, and the clinical results are seen after the 2nd month. However, the parameters do improve in several areas for childbearing women and postmenopausal women. I would like to insist that vitamin B and selenium help have more vitality during the first week, And we also have another product, that's the Libicare gel. It's a stimulating gel. It stimulates sensations in the genitalia. I like it very much. I do recommend it because one of the key aspects to enjoy sexuality and to be satisfied sexually is to know your body well. And to know your body well, it's important to feel all those sensations in the genitalia. The gels do help and intensify those sensations and help women understand better their own sexual response. This gel has ginseng that increases and improves microcirculation and the tactile perception, and arginine. Arginine is a precursor of nitric oxide, and this is key to relax the muscle in the area so we have a better blood flow in the genitalia. Arginine is very well known in men in erectile dysfunction. Then ginkgo biloba also improves and increases the blood flow, and it also increases the sensations and desire. And hyaluronic acid, the niasomes that help with the elasticity, and it also includes a stimulating complex with ginseng, vitamin B6, damiana, and mint oil that increases sexual desire. And gels are very important. They help intensify all those sensations, to be aware of the sensations in the genitalia. And this can be part of the foreplay in sex. This is a clinical study conducted with this Libicare gel in 21 women who would use the gel before sexual intercourse, and 90% of these women stated that the gel improved their sexual intercourse and it also improved their orgasm capacity, and it helps with sexual relationships. The tolerability is very good. The texture is also very good, and all its features are very well accepted. I will end my presentation now so we can have time for questions. I'd just like to say that low sexual desire is the most common sexual dysfunction in women. It has an impact on their quality of life. It leads to women posing themselves many questions with regard to themselves and with regard to their relationships. Women know how important it is for their relationship to have this physical attraction, and when that physical attraction is reduced or there's a reduced desire, then women start questioning many things, and many questions arise about their partner. For example, if their partner is the right partner, if their partner is just a friend. So all these questions arise, all these thoughts that can lead to anxiety and that can have a negative impact on their relationships. Therefore, this should always be borne in mind. One thing is not to be sexually active because you don't want to. And another thing is to feel that you have a lack of desire due to various problems. So it's important for patients to come to us so that we can discuss these problems. Then, testosterone and hormones are very important in women's sexuality. They play a key role. We need to define what is their exact relevance, because there is still a lack of knowledge in this area, but there is new research, there's this new interest by science and by the industry, because women have always taken care of others, and now women are starting to take care of themselves. And this means that women are also now focusing more on their sexual activity. Women want to enjoy their sexuality in all the different stages of life. Therefore, I think that in the future we will see interesting findings, interesting research in this regard. And I'd like to say that Libiker is a natural product, it's a non-hormonal product that promotes sexual desire, and it has a rapid effect on increasing vitality and well-being. And this is absolutely key for women, particularly when we consider our very busy lifestyles. And there are scientific studies that support Libiker, and I would like to urge ProCare and all the pharmaceutical companies that work with phytotherapy to carry out clinical studies, because that's very important for healthcare professionals, so that we prescribe products that have an efficacy that has a scientific basis. Well, this is the end of my presentation. Thank you very much for listening. Now we will have time for questions. Thank you very much. Thank you very much for your presentation. Congratulations. It's a wonderful presentation. And I like phytotherapy and I use phytotherapy, and I believe it's very important when we recommend a product that it's a product that has a good quality and safety profile, because you very often have people buying products on the internet that have no scientific evidence. And all of you who are listening to us know how important it is to use phytotherapy products that have the appropriate safety profiles and quality profiles. All right, we have some questions here. The first question is whether this product can be used in breast cancer. Well, I would think so. Yes, I would say so. Yes, I agree, because the phytoestrogen dose is low, and Damiana is an aromatase inhibitor, and we know how important aromatase inhibitors are to block the effect of estrogens. Most cancers are estrogen dependent. Therefore, I would say yes. Additionally, when we talk about breast cancer, it's important to talk about these products, because we have many cancer patients who are very young, and when they start with chemotherapy, they start thinking about what is going to happen with their lives. They don't just worry about the effects of chemotherapy, about losing their hair, but they want to know how their life is going to change, how their sexual life is going to change. So it's very important that we can offer them this type of products so that they have a good quality of life. Yes, I agree. Yes, quality of life is absolutely key. Laura Clavijos is asking how the COVID-19 has impacted the sexual life of our patients, and what are the key issues in this regard. Well, I think that there are many key issues here. Firstly, there'll be some struggles maybe with the younger population, with the younger women, because I think that young people don't think that we're living a dangerous situation. So we have to be careful with them. But then we have another population that's more adult and more aware of the current situation. And there are women with stable relationships, and if they have any problems, they will be asking for guidance more, because if they have a good, stable relationship, they'll want to take more care of it because they've realized how important it is to have stable relationships, both emotionally and sexually. So I think that they'll be interested in improving their sexual relationships and they will ask for more guidance. There's also a group of women who have no partner, who've just got divorced, or who have occasional partners. And our role is absolutely key also in this group. We'll have to inform them well, and we'll have to be careful with the fear they may feel. There'll be many women who'll be very afraid of having sexual relationships. Maybe they'll increase their individual sexual activity, but they'll be afraid of having new sexual relationships. And it's important here to inform them well, to help them feel safe. It's important to explain how things will change, because until now, very often, women felt the pressure of having sex on a first date. There'll be changes, there'll be more virtual sexual relationships, and I think women will take longer to have sex. They won't have sex on the first date because, as I say before, they would feel the pressure of having sex on a first date, even if they didn't feel like it, or even if they didn't feel ready for it. Very good. Another question. For how long should this product be taken? And when do you start feeling the first effects? Well, Livycare, and what I'm going to say now is applicable both to phytotherapy and to pharmaceutical products. We all know that prescribing a product without explaining it properly and without giving proper guidance will lead to a poor adherence. So it's very important to provide patients with the right information, with the right advice. And it's after the second month that patients start noticing the effects on their libido, on their sexual response. And I think, according to my experience, what I usually do is to assess the response after 2 months, then at 6 months, depending on the patient's evolution, maybe I will discontinue the product at 6 months or at 4 months even. But the patient can have this product again in the future when they go through a difficult patch, where they have more fatigue. All right, there's another question. Are there any side effects, any interactions with drugs such as Centron? Well, I have to say that ginkgo biloba would need to have a higher dose to interfere with Centron. Yes, I agree. However, warfarin and Centron are the two drugs where we should be careful. These are the two drugs we should be careful with. Yes, and another question is whether there's an absolute contraindication with Livycare, and I would say that the only absolute contraindication would be an allergy to the ingredients. For example, fenugreek does lower insulin resistance and sugar levels. Another question. In young women, non-menopausal women, can the gel be prescribed by itself? Well, I have to say that in the study, there were many young women and they were very satisfied with the gel. Well, I've just answered the question. Yes, no problem. You've answered the question. The thing is that young women use the gel in the foreplay, in a playful manner. They know better their bodies and their sexual response. My friend Maria Jose Barrera from the Velázquez Clinic works with breast cancer, and she would like to know whether there are any interactions with tamoxifen or aromatase inhibitors. As far as I know, no. Can I answer the question? Yes. I think that there won't be an effect on the receptor because there's Damiana, but I think that there will be no interference with tamoxifen. I think we can say that it's safe. And Tribulus also helps with the DHEA because it has protodiosine and it's a precursor of DHEA. And that's very interesting. And it's already used in some vaginal products. So I think it's good. Another question, do you need to monitor your patients regularly and how often when you prescribe Levicare? And another question is whether there's any interaction with breastfeeding. I have to say that I would be cautious with breastfeeding. Yes, I think that the monitoring should be done every 3-4 months. And if the patient has followed our suggestions and advice, and the product is not working, then there'll be another problem, a psychological problem, a relationship problem, and then I would refer the patient to sexual therapy. And if the product works and the patient is happy, then she can discontinue it and then take it again in the future if she needs it, if she starts feeling fatigue again. I'd like to say something else about breastfeeding. There are no clinical studies in breastfeeding, but I have to say that with Trichinella, there's no problem. Trichinella is an ingredient that has been used since ancient Egypt times. However, there are phytotherapy products that have saponins that can stimulate estrogens. So I would say that one has to be very cautious in prescribing phytotherapy in breastfeeding because there are no clinical studies. And of course, we don't want to have an overexcited baby because of the ingredients of a phytotherapy treatment. Of course not. I agree. We have to be careful with breastfeeding. I totally agree. Another question. Can the gel be used in the pelvic floor? Is it interesting to use the pelvic floor? The gel in the pelvic floor? Well, I know it can help with the vascularization with ginseng, so I suppose that it will improve the whole sensation in the area. Yes, because very often in the pelvic floor we see prolapse and contractions. And the gel can be good for massages in the perineum area. That's a good indication for the gel. Very good. Another question. Can it be associated with ospemifene? No problem. Yes, because ospemifene works at one level and this product would be working at another level. So it's no problem because we are not acting here on the estrogen receptors. Another question, how should the pills be taken? 2 at once or 1 in the morning, 1 at night? I always recommend to have 2 pills at the same time because adherence is not so good when you have 1 pill in the morning and 1 at night. So I would recommend 2 pills every 24 hours. Yes, that's what I do. I agree. Another question. Do you think that this product could be appropriate also for the husband? So we have a couple treatment because it has interesting properties for men. Of course, yes. The thing is that we don't have any clinical studies. But Tripolus has been broadly used for erectile dysfunction. That's very often it's due to a testosterone reduction. And I think it could be interesting to have a clinical study in men with this product. Yes, because the mode of action is so good. Yes. Yes, we have this aromatase inhibitor, then the effect on the testosterone, the effect on the DHEA, and in the gel we also have an interesting ingredient, that's elastin. Yes, I agree. Well, let me ask the last question, or we'll spend all evening here. After the initial treatment, can this treatment be taken a second time? Of course. What's key is to do well the first treatment. If the first treatment, the initial treatment, is done properly, following the specific suggestions with the right information and taking the product properly, you will see good results. And if the patient sees good results, then she already has a good experience with the product. And if she needs it again in the future, she'll have this first very good experience with it. Thank you very much. We are going to end here the webinar. However, I would ask you all to fill in the satisfaction survey, please. If you don't want to fill it in now, do send your answers by email. It's important to us to know whether you find these webinars useful or not, because there are so many webinars available, and the goal is for you to enjoy it and to organize fruitful webinars. So I would like to thank you all for being here. Thank you, Paquita, for your presentation. It's been a wonderful presentation. Really. So thank you. And please fill in the satisfaction survey and take care of yourselves. We have to be careful with the COVID-19. Take omega-3, take vitamin C, and a big hug to all of you. Thank you. Goodbye.